So, good day everyone, especially to our super moms and super dads. I'm Dr. Elmer Hilary Balbin. I'm a pediatrician and a pediatric infectious disease specialist practicing here in the Philippines, specifically in Bacolod City. So, I made this video in response to some of the requests, especially from parents and of some of my friends who really want to learn more about hand, foot, and mouth disease. So, as a disclaimer, this is not an industry sponsored lecture. This lecture is intended primarily for parents and primary healthcare workers. This is not also a medical advice. And of course, this lecture does not replace sound clinical consultation in the presence of signs and symptoms. Now that we have all that cleared up, let's start. So, what's hand, foot, and mouth disease? If you look at the background of it, it is a common illness that usually causes fever, mouth sores, and rash. And as the name implies, the location is in the hand, the foot, and the mouth. It can spread quickly at schools and daycare centers, and recently we've seen cases of hand, foot, and mouth disease, especially in the nursery and kindergarten levels, and even in daycare centers. And we want to point out that this disease usually affects children under 5 years old. So you might ask, why under 5? The specific reason is unknown, but more or less it might be because of the immature or naive immune system of very, very young children, most especially those under 1 year old or in infancy. And when we talk about the causes of hand, foot, and mouth disease, so just bear with me. Technically, it's caused by viruses, namely your Coxsackie viruses. It can be A6, A10, A16, or your enteroviruses like D68, 70, 71, which are the most common ones. And of course, hand, foot, and mouth disease is not caused by a bacterial infection. So it's mainly caused by a virus. So parents might ask, Doc, how is that transmitted? And how does it transfer from one person to another? As for the transmission, there are many types of transmission for hand, foot, and mouth disease, but the main one is droplet, which is due to your saliva or mucus, either from nasal or oral secretions. Number two is contact, especially if there's vesical fluid and it breaks and comes in contact to another person who doesn't have the disease, so that can happen. And of course, contaminated surfaces. When in the case of contaminated surfaces, if you look at WHO, CDC, in the book, it depends if the surface is liquid or dry. For liquid surfaces, it usually stays for 11 days, but for dry surfaces, it can stay there only for a few hours. But those few hours is enough to spread infection to a child, most especially in dry surfaces in schools, which can be your desk, which can be your books, which can be your notebooks, which can be your railings, which can be that faucet in your comfort room. So those are the surfaces that can be places wherein your enterovirus or your hand, foot, and mouth disease viruses can stay. And lastly, of course, feces, because again, it's an enterovirus. It can spread to your feces, which can last even for a few weeks. And if we're talking about hand, foot, and mouth disease, we want to know, as parents, you want to ask, Doctor, how long will that disease last in my child? When we talk about disease transmission, we want to know about their period of communicability. So it's the time wherein that person or that child is able to transmit that disease. So it can start 1 week on the first week of illness until weeks after the symptoms, like your fecal shedding, because again, it can be shed through the stool. So that's why it's very important to have good hygiene, good anal hygiene, or to clean your stool properly or dispose them properly. Or it can last for 1 to 3 weeks for respiratory shedding, again with your nasal secretions, oral secretions. And when we talk about incubation period, that's the time wherein the virus enters your body and signs and symptoms come out. Because usually, if you get infected, it doesn't really come out immediately. Okay, so it doesn't come out immediately. It usually stays in your body, it multiplies, and it usually comes out 3 to 6 days after you've been infected. That's why if you notice, if for example you got a classmate who has hand, foot, and mouth, you got infected on Friday, you might notice the symptoms come out on Monday or Tuesday. So it doesn't come out immediately in the first 2 days. So, knowing that transmission, of course, you want to look at the signs and symptoms of hand, foot, and mouth disease. As for the signs and symptoms, we have to take note of the early symptoms because in the early phase of hand, foot, and mouth disease, it can be a non-specific. When you say non-specific, it means it can mimic any kind of infection, any upper respiratory infection. You could have fever, you can have sore throat, or malaise, or body weakness, or fatigue. So you might notice your child to complain of fever, sore throat, and sometimes they're just too weak or don't want to go to school or don't want to eat. Those are some of the early signs of hand, foot, and mouth disease. And after those few days of early symptoms, that's when the classic symptoms come out. They begin to experience painful oral sores. You might see a rash initially, like a pinpoint rash on the feet and the hands, which will then progress to vesicles or fluid-filled lesions. So what I see in the clinic is like this. Sometimes some of the doctors or some of the nurses might mistake it as an upper respiratory tract infection, but 3 days after, 6 days after, that's when you start to see the lesions. It might look like small red dots, but eventually it will spread like this here in the picture and form vesicles. So as parents, of course, you want to know how is this diagnosed, or is there a test to check if my child has hand, foot, mouth disease. So for the diagnosis, mostly it's really clinical. When we say clinical, we just base it on the signs and symptoms. There are no laboratory tests, or rarely is laboratory tests needed. You do not need to take a CBC or urinalysis or a stool exam for hand, foot, and mouth disease, or even a chest X-ray, because again, the diagnosis is clinical. But unless of course you have other symptoms, for example, you have cough, you have diarrhea, you have painful urination, so that might of course signal to your doctor or your physician to add more tests to check if you have other bacterial infections or other infections other than hand, foot, and mouth disease, which can of course happen. Okay, so other than hand, foot, and mouth, you might have other infections also, which can coexist. And of course, it's very important for hand, foot, and mouth disease to be recognized because it can be sometimes mistaken for the cutaneous form of HSV or herpes simplex virus infection. We will tackle herpes simplex virus infection in another video, hopefully soon, if this video is effective. Okay, so again, as the diagnosis, it's really clinical and rarely are tests needed. Now, let's go to the most important part, the treatment. Parents really want to know what do I do or what do I give. Again, of course, this is not medical advice. This is just an overview on how we give treatment for hand, foot, and mouth disease. If you have symptoms, just go to your doctor. So, of course, it's supportive. All right, we give antihistamine. We can give antipyretics if there is fever, oral soothing agents for mouth sores, so your doctor can give that. And of course, we encourage hydration, or you drink plenty of fluids, because most of the time, this illness will just disappear after a week or so. Okay? And most of the time, the children just get better with no residual scars or residual rashes. It's also very important for parents to note that if your child has hand, foot, and mouth disease, most especially if he or she has mouth ulcers, you should avoid hard, hot, spicy, and salty foods because it can aggravate the pain. It is very painful for your child sometimes to eat. I also had a case wherein there was a 3-month old child who had hand, foot, and mouth disease, was infected by his brother. So sometimes infants or very young children under 1 year old who has hand, foot, and mouth, the parents might find it hard to breastfeed or to feed the child through the bottle, because again, it's very painful for them, especially when the nipple or the bottle comes in contact with the mouth source. Okay, but trust that you can give oral soothing agents, and eventually this will just disappear. So, and of course, if you talk about hand, foot, and mouth disease, there's no specific antiviral treatment for now. All right. But then again, I want to point out that sometimes we might give an antiviral if we might have hard time suspecting it might be a cutaneous form of herpes simplex virus infection. And of course, there are case reports on using an antiviral for hand, foot, and mouth. But for mild symptoms, more often than not, we usually give supportive treatment only. And it's very important that sometimes we need to treat a secondary bacterial skin infection if it's present. Alright? Alright? Because if you look at it, there are times where the child might scratch it too hard, or sometimes there might be trauma or impaired skin integrity, which can be a portal of entry for other bacterial infections like your Staphylococcus aureus or Strep pyogenes. So it's not uncommon sometimes to see that other than hand, foot, and mouth disease, you might have secondary cellulitis or secondary impetigo or secondary erysipelas or secondary infection. So again, your doctor will be able to note, will be able to see if we need treatment for secondary bacterial infection. So as parents, you might ask, doctor, when should we seek medical attention? So seek medical attention if you have signs of dehydration, if your child is not feeding well, if your child is sick, if your child is getting weak. Go immediately to your physician or to the nearest healthcare facility. If your child has high fever, we also encourage you to seek consult, okay? Because if the fever is prolonged, sometimes there might be cases wherein your child who is less than 5 years old might have febrile seizures. So it's very important to bring the child to the hospital. Lethargy and of course unusual symptoms, those are also indications to bring your child to the nearest hospital. Why? Because there are some forms of enteroviruses, especially your D68 or A71, which might cause a septic meningitis or infection in the brain. Alright, so it's very important for you to know that when your child begins to have increased sleeping time, or when your child is getting weak, or if your child keeps on sleeping or has seizures, you bring them immediately in order to rule out there's no secondary viral infection in the brain. All right. So those are the things that the mother would take note. But of course, I trust that mothers have a secondary instinct. So if you really see your child who's not getting better, immediately bring him or her to the nearest hospital. And lastly, we want to talk about prevention and control. So how do we prevent or how do we control hand, foot, and mouth disease, most especially in the school and in the home? And also, I forgot, you have to take note that I also have cases of hand, foot, and mouth disease wherein the child has got it from a playpen or a play place in the mall. So that's also a common place to have hand, foot, and mouth because you have those shared toys, you have those shared rubber balls, you have those shared jungle gym. So those places can also be a foci or a place of infection for hand, foot, and mouth disease. So for good hygiene practices, we should take note hand washing, very important. It's a very universal rule. You have to clean the surfaces, avoid close contact during illnesses. We really encourage that for children who have hand, foot, and mouth disease, they should be kept home, of course, until of course the lesions disappear. And for now, there is no vaccine currently available for hand, foot, and mouth disease for humans. Although I've heard there are some clinical trials for humans, but more often than not, the ones that are available are for animals. Alright? So those are the basic things that a parent and a healthcare worker should need to know about hand, foot, and mouth disease. So if you have any more questions or concerns, again, I encourage you to visit your nearest doctor or your nearest healthcare facility. So again, this is Dr. Elmer Balbin, your pediatric infectious disease specialist, saying thank you for your time, and of course, thank you very much for your attention.